The fact that they're playing with their friends and they're feeling comfortable is great. But another aspect of feeling bossy is also maybe feeling in control. So we accept where they're at and we're showing them that's okay. We're dipping our feet and we're getting there. It really makes them feel safe and comfortable. For a child, dysregulation is their way of sharing that maybe something is going on, that they're feeling something.
Welcome back to another episode of the Unspoken Words podcast, a Selective Mutism podcast by the Smart Center, produced and published once again by New Edition Productions. This episode features our latest installment of our Ask Dr. E series, our first of 2026, where we answer real questions from our Unspoken Words listeners. In this episode, Dr. E is joined by Dr. Jenna, and the two of them address 5 important questions about SM, including behavioral challenges in children who are verbal with peers, whether SM runs in families and how to support multiple children, school separation anxiety and its connection to SM, strategies for progressing beyond whispering, and how to help children who refuse accommodations and show no visible motivation to communicate. Before we get started, if you have any questions on anything we hear in today's episode, please head to selectivemutismcenter.org/AskDrE, that's ASKDRE, and enter your question in the form. Dr. E will probably be accompanied by Dr. Jenna for the rest of this year on these episodes. So if you want your question answered on this podcast, on blog posts, on social media, by either Dr. E or Dr. Jenna, please make sure to submit your question in the form. And for the best of this episode and every episode of Unspoken Words, make sure you're following us on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words podcast by Dr. E over on YouTube. So without further ado, please enjoy the latest episode of the Unspoken Words podcast.
Before we get started with the episode, are you a parent of a child with SM desperately looking for resources to share with your child's teachers? Last year's Selective Mutism in the School virtual conference sold out, and we're excited to share that this year we're doing it again. Virtually join me, Dr. Elisa Shipon-Blum and Jennifer Brittingham on April 10th from 9 a.m. to 5 p.m. Eastern Standard Time for practical, evidence-based strategies you can use immediately in your classroom. Whether you are a school psychologist, educator, speech and language pathologist, or counselor, this conference is designed for you. Plus, all attendees earn 6.5 continuing education credits. Learn more and register today. Visit the link in this episode's show notes. Let's help more students find their voice in school. All right, enjoy the episode.
Hello, listeners. Welcome to Ask Dr. E and Ask Dr. Jenna segment. We are excited, as I always am. I feel like I start every single episode like that. Do you think that, Dr. Jenna?
Definitely.
Even when we're at Communicamp, we just had a Communicamp last weekend. Every day, I'm like, I'm so excited. So I am super excited to be here. The questions that we answer are from all of you. So you will see in the show notes where you can send your questions. This is how we get our questions, and we want to interact with all of you and help you feel supported and provide you information that will help you and your child. So we're excited. So we have 5 questions today. Let's kind of start. Let's get right to it. How you feeling, Dr. Jenna?
I'm feeling good. I'm excited to be part of the segment. I've never been in one of these segments, so I'm excited to get started.
We're excited to have you here, and you have so much experience over the last, 10 years plus with us. So you've been integrated into the SM world since you're a very little girl. And here you are now as a doctor and an integral part of what we do at the Smart Center. So we're excited to get your angles on a lot of these answers. And let's go. So the first question is from a parent, and the mom writes in and says, my young child sounds like she's a preschooler, early elementary age child, talks very easily with other children. That's positive, right? However, she becomes very bossy, mean, and physical with friends when she doesn't get her way or get what she wants. Do you have any guidance on this? So this is a loaded question, and we could probably spend an hour just on children and difficult behaviors. That's one of the things we often see. But I think it's important that we kind of frame this for this family and kind of give them some guidance to move forward. Any thoughts, Dr. Jenna, you want to start out with?
Sure. So like you said, I think that is a loaded question. I think a few things to kind of keep in mind. First thing I always am curious about is what is maybe going on for this specific child? Are there any potential like underlying whys of SM? Specifically, I'm thinking about, a lot of our kids that maybe have some sensory challenges or some of our kids who might have some other, developmental aspects. They potentially could feel dysregulated at various times of their life. And so what I'm hearing a lot of is it's great that the child's comfortable, but I'm wondering if for whatever reason, the dysregulation piece is what's been really challenging at this point for this child. And so there's a lot of aspects to help with that. And again, the fact that they're playing with their friends and they're feeling comfortable is great. But another aspect of feeling bossy is also maybe feeling in control. And we know that selective mutism is a social communication anxiety. And so part of me also wonders if that could be a coping mechanism for that child to feel in control, feel like their play is predictable, that they can choose what they want to do, because many other areas of life, maybe they feel very out of control. And for a child, I always say for a child, dysregulation is their way of sharing that maybe something is going on, that they're feeling something, right? But as adults, we have the capability of getting our words out and explaining, I'm feeling anxious because of this, or I'm feeling worried because of that. Sometimes, especially I think you shared as a younger child, we don't always have that dialogue, and that's not even stemming from SM, that's just from a developmental standpoint. So sometimes when I see kids that maybe act out in certain ways, it's also maybe something, again, like that underlying piece that I think is really important to explore because as we know, SM is so much more than not speaking. So very loaded question, but those are kind of some initial thoughts that I have.
Yeah, and because SM is a social communication anxiety, we can't, minimize the fact that if a child is acting out and feeling out of control, it could be their anxiety manifesting in a maladaptive way. And sometimes I'll ask a family, and this just happened recently, where we had a early elementary age child that really was, frustrated and can get angry and kind of mean to her friends. It turns out that one of her siblings has a really difficult time regulating his emotions. And so he will act out, he will talk negatively to her, and the family struggles with that older brother. And so one of the questions is there any modeling of behaviors at home that maybe she is seeing? And this, look, your child is an older preschooler, 4.5, 5. What I would say is this is a discussion to have at her developmental level and how it might make her feel when somebody else would maybe talk to her in that way. So in a calm moment, talking about it, dealing with that in therapy. And one of the things we, talk about a lot is SM being a social communication anxiety and having factors, not just necessarily a shy, timid child or not necessarily a sensory based only child, but that there's other whys that contribute. So, what I would want to know is does this child have social reciprocity, social interest as she's, 4.5, 5 years old? So is there significant rigidity in her behaviors at home and out and about? Is there a lot of sensory dysregulation? Is there executive function or attention regulation difficulties? And what is her pretend play like when she's at home in the comfort of her environment? So these are the questions that I would want to ask. It's not treat to speak. How do we get her to speak? She's actually speaking, but it sounds like there's some other behaviors going on. And is it anxiety driven and more just emotional dysregulation and maturity? Or listen to me, or I'm so much to say, I'm like saying it like discombobulated, or are there other things going on? Any other comments, Dr. Jenna, on this?
No, I think you make a good point. I think whenever we focus on questions like this, I think it's important to keep in mind how is that child engaging in their home environment when they're most comfortable. And so if we're still seeing some of these challenges, like you're saying, maybe with parents and or with siblings, there could be some other aspects that are going on. And I think again, that's where working with your treatment provider and really trying to create, a good game plan for how we can help navigate that, I think is going to be really important because, like you said, for a child who's 4.5 or so, they might need some prompting or some facilitation for them to learn, various skills.
No, thank you. I think this is great insight for this family. And one of the things that we do with these Ask Dr. E and Ask Dr. Jenna questions is we will notify the family and let them know, hey, on this episode, we've answered your questions. So please know we take this very seriously and we really do appreciate these questions. And one of the reasons I'm so passionate about this is that the questions that you have are probably questions other parents have. So it's helping you, but it's also helping many of our listeners who have similar challenges with their own children. So thank you for submitting this question. So let's get to our next question, selective mutism in siblings. And I know there's a podcast episode that I did earlier on, and you can go to our search bar on the selectivemutismcenter.org website and search out siblings, and you should get a podcast episode. We'll also put that in the show notes. So here's a question. Our early elementary age child is being evaluated for SM. We highly believe she has SM. Our 2-year-old also shows similar silent behaviors. So we have a couple questions. One, can SM run in families? And how do we support our younger child? So I really think like each question could be just, a whole episode, which is why we do have an episode on siblings. So I do suggest for those interested in SM and how it affects siblings is to listen to that other episode. But the answer to the first question is yes, SM runs in families. And we do see that in genetic studies that there is a component genetically and biologically. So we do see that this anxiety can exist, specifically the social anxiety, the generalized anxiety. We do see it in families, but of course it can be learned as well. And it's interesting, Dr. Jenna, because for those listeners listening, you are my daughter. You are not the daughter that had SM, and you are very outgoing. Would you agree?
Yes, very much so.
You're very much like me, and you inherited that outgoing temperament. But interestingly enough, you were about 21 months younger than Sophie, who had SM and the more social anxiety, but you did mimic her. So when we would go out and about, similar to this, you were manifesting these behaviors. You wouldn't talk to the swim instructor, the gymnastics instructor. You mimicked your sister. You copied what she did. But yet innately in the comfort of your home, when you had some friends over, when you weren't always with your sister, you were very outgoing. So that wasn't your temperament. So interestingly enough, you can talk on this. You probably don't remember, do you?
I don't. I get parents asking me this sometimes, and Sophie was working through a lot of her SM and was treated around, I think it was when she moved really to kindergarten, which is where she really started to like blossom more. So I was still so young. I was only 3. So I don't fully remember, but I do remember copying her my whole life. So in that realm I still do, which she can definitely attest to. But I'm not surprised by that response is what I'm trying to say. But I do want to speak to, you mentioned how, SM does run in families. And sometimes I share with my families that, when we think about how SM, right, is a result of many contributing factors, I tell families that a lot of times, like you shared, it's really that social anxiety or that timid temperament aspect that is very much a genetic component. And when we've done our research, we have found that really like 80 to 90% of our families really fit within that structure. And so we see it with parents and their child or siblings and their child. And it's not even always necessarily the SM piece, because again, remember, that's a result of, but it's more that timid temperament piece that is a really big genetic component. So if you listening, think back to maybe your family structure and think about, yeah, I guess there is maybe some of that timidity that genetically has been like predispositioned. That is something that could run in families. The other interesting component is I've actually had some families share with me, and I've noticed this post-COVID, so I'm kind of shifting the question a little bit, but where it's not necessarily that they're noticing that their child is mimicking their sibling, but just with the fact that COVID, we're not necessarily getting a lot of this exposure and going out and about and doing things as much. A lot of my families have shared, hey, a lot of the SCAT strategies that we're learning and we're working through in treatment with you, we didn't even realize, but it's really helping. So like sibling, right? So like, even though their sibling is in treatment, kind of working through things, the other sibling, also was noticing that like they were also benefiting from practicing some of these strategies just because our strategies are very practical and really help in that aspect as well. So I find that very interesting too, that sometimes families do bring siblings into the treatment. Not necessarily, we don't want to ever burden a child, and we don't want a sibling to feel like that responsibility, but I do find that fascinating.
Yeah, and I would say we see that a lot in more being 2026 now, that I would say that families that have children in the 6-year-old, 7-year-old, 8-year-old, 9-year-old range were way more affected. So thank you for bringing that up, because for some families, 2 years, they were not engaging socially, and therefore they have more insecurities and they may be a bit behind. In this particular case, though, this child is only 2. So my guess is this is either mimicking her sibling. So here's the question I'd want to ask this parent that wrote this in. What is your 2-year-old like when your 2-year-old is not with their sibling in public? Like, let's say you take your sibling out, the 2-year-old. What is she or he like? And what is he or she like at home? Well, I mean, I don't know if this is a boy or a girl. So let's just call it the 2-year-old. What is this 2-year-old like innately with their temperament? Because that's a really important thing. And as I said, I lived this. You were very outgoing. So with the friends that you did have, you were very outgoing. You're very outgoing at home. You were very outgoing in public when you weren't in a social situation actually with your sister. So it's interesting. So I would say taking that 2-year-old out separately sometimes, not always with their sibling. And the SCAT strategies are real strategies that work for a child that's shy or timid. Handover, takeover, front line, preparing visuals, asking a choice question with the right answer second, playing some games like give my order with the visual. I mean, there's so many strategies we do, teaching teachers how to ask questions, when to ask questions, social comfort precedes communication. I can go on and on. You don't even have to have a label of SM to benefit from those strategies, because with families we talk to, they will say, wow, this makes so much sense. I don't take my daughter shopping. I'm always running quickly, or I order Instacart, and we don't go to stores. We have Amazon. And that's great. I don't go to stores. I order Amazon. I order Instacart. But I don't have a difficulty with social communication. But when I do walk into a big store, I'm like, wow, this is a big store. I haven't been here in a long, long time. So my point being is that we are a society now where we aren't going out and about as much, and post COVID, families aren't having the play dates as much. So I saw, and I'm sure you did, a huge drop in play dates and get-togethers. Families just don't have it as much. It's just so interesting. So exposures, 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 meeting those children where they are. Let's say the 2-year-old does have SM tendencies. We see SM in siblings a lot. We see twins. We see it. But as you mentioned, Dr. Jenna, it's the genetic kind of social anxiety, the family history of the generalized anxiety, the social anxiety. That's the stuff that you see more or less. But if a child doesn't have that, let's say they have other reasons for their SM, it isn't as familial, it isn't as genetic.
Yeah.
So I hope that was helpful to this family. There's a lot we talked about. Any other comments on that?
The only other thing I would add is just for this family to hear, or another family that has siblings, is I just want to normalize that this is very common, and we do see many families that travel for our group intensive treatment community camp where we have many siblings that will come to the camp, where one might be, a 12-year-old, and then their sibling who's 5 might also come because they're working on various skills. So not to say that all siblings follow in that same path, but if that is the case and you're noticing that, your other child does have some of these challenges, and like Dr. E said, maybe you're noticing it apart from their sibling, and maybe you're questioning. Now, I think you had shared the child was only 2, so I would definitely give it maybe a little bit more time, seeing how they engage socially, but it's
And to
definitely something that
facilitate, right?
and
Don't wait,
facilitate.
facilitate. Like,
Mhm.
this child may not meet, look, the child's 2, doesn't maybe have even the language skills. But if you're seeing a tendency to, practice handover, takeover, practice front line, practice game playing, at age appropriate. Like, the child's only 2.
Exactly.
So we just have to be realistic. If she's in preschool or he's in preschool, have a little play date at home over an area of interest. Ways to build that social comfort, the confidence, the connection. That's so important.
Yeah.
So let's keep on moving because, again, we have 3 more questions to talk about. And it's kind of a neat segue into this next question. My elementary age child with selective mutism talks to some friends and plays non-verbally with many, but struggles to separate from parents and enter school. Interestingly enough, this same child was able to separate quite easily in kindergarten. So it sounds like this is somewhat new this school year. Is this related to SM or adjustment, and how can I help? And before you give your input, I would like to say selective mutism doesn't cause anything, it's a result of. So I need our listeners to understand SM isn't causing it, it's a result of. If your child has social communication challenges, those social communication challenges, of course, are, a result of a reason. And we have to understand those reasons. And so when I hear this question, the first thing I think of social comfort connection precedes confident communication and also just even confidence. Does this child have the supports to help them separate and feel secure? Thoughts on your end?
I was gonna say actually a very similar thing, so like mother like daughter, but I was gonna share that, yeah, I think we know that, our comfort and our communication changes setting to setting and person to person. So I would be curious about, was there something different going on in this particular moment for this child in this particular classroom with these particular people? Was there a moment that happened maybe during the school year, right? So is it that you're noticing this separation more drastically? And maybe we want to explore that more with the teacher because I have seen this with some of my clients where we do have a very sensitive population. And so I actually was just working with a family where the child recently, it's kind of become a little bit more exacerbated with their separation. And then we had found out that, there were a few kids in the class that were making some comments, and the child is very sensitive, but also, again, doesn't always feel as comfortable to advocate for that. And so we had to kind of navigate that too. So my thought is the separation is coming for a reason, right? In the fact that you're that safe person and you're that comfort. And so how can we create more of that comfort into that environment? And it might take step by step, it might take intervention, it might take a conversation with the teacher. But I definitely think that it is common. There's nothing wrong in that scenario. It's more like, let's take a step back. And we always say, like, look, listen, and learn. Like, what is it about that situation that is maybe going on for my child? And then there also are many kids, when you said, is it related? As Dr. E said, I mean, yes, SM is a result of, but there are also many kids that have other anxieties, right? Separation anxiety, social anxiety, generalized anxiety. Like it is a social communication anxiety. And so, with that, again, we do have a tendency to have a population of some individuals that have a mixture of different anxieties. And so, that could be a piece that's playing a role. But the reason I'm leaning more towards what is maybe going on more in this environment is, as Dr. E said, it sounds like for this child, we didn't notice this maybe a few years back in school. So something maybe about this specific space is causing more of that separation challenge.
And because we have so many sensitive beings, right? Loud, large, lots of people. Was kindergarten class? It sounds like maybe we're like a first or second grader. Was the kindergarten class and maybe the first grade class smaller, less stimuli? I have a patient I was working with recently that really struggles in class this year. Part of the reason was there were multiple boys that were very not only outgoing, but inattentive. And so there was very like a loud classroom with a lot going on and overstimulating for this sensitive child. So that kind of fear was elicited and that avoidance was elicited. And so what are you going to do? You're going to hang on. You're going to hang on to what's comfortable for you. So assuming these things have been ruled out, like you said, I love it that you brought up what's happening in the classroom. I'd like to kind of talk about what accommodations are in place to help this child and interventions to help this child with the separation. So, what is the connection, the comfort level with the teacher? Has this child, built that comfort connection with the teacher in a one on one small group way where that child feels there's a safe person? someone they can really connect with. A lot of teachers have 30 kids in their class, 20 kids in their class. It's hard to build that. Social comfort precedes, communication. It fuels that connection, fuels confidence. It fuels it all. So I would want to know that. Are there buddies that this child is connected to? It's one of the hallmarks to social comfort precedes communication. Progress doesn't happen in a group, is create a buddy process. Does this child have 2 or 3 buddies that this, parent is pairing, grouping, having outside get-togethers? The parent did mention that there's some friends that the child talks to. Is there still a safety there? Is there still a comfort there? Is the teacher consistently pairing and grouping? I've had kids with separation anxiety. One of the things that we've done is we go to school, either pick that other child up if they're a nearby neighbor, they sit with them on the bus if they're taking the bus, or they meet them in the school playground or drop off and they walk in together. So I've had many kids that meet their friends right at the kind of the drop off and walk in together. I've had to do it where the parent walks in, drops the child off, then the next, creates this game or this chart with the child where we drop off. And then the next day it's 5 feet further from the classroom, 10 feet further, 20 feet. And we do this where the child checks off, rates their feeling, checks off. It's all about this child feeling in control. So there's so many things we can do aside from worrying about talking right now. But if this child isn't feeling safe and secure and feels almost abandoned, we need to talk with this child about it and feel, and like you said, what is missing? Because there are ways to transition from separation anxiety, with separation anxiety. But is this separation anxiety a huge aspect outside of school? We have kids that can't even separate in the home. They can't go to the bathroom without their parents. They can't go to a friend's house. They can't hang with grandma or grandpa. There's a lot of separation. So I would want to explore the separation more. What's going on in the home environment versus is it just with school?
Yeah. I would be curious about how are we modeling our behavior as well with that child? And many times our kids feel, again, we're talking about how they're very sensitive. Our kids feel our emotions and our feelings as well. And so
Great point. I
sometimes,
love this.
yeah, well, sometimes I have to talk with a lot of my parents that have some kids with separation because that doesn't feel good for me as a parent, right? Like, I don't want my child to feel this way. And so I'm on edge as I'm dropping them off. And then that's making my child more on edge. And it's kind of this cycle, right? And so we have to also work with you as parents on how can we make you feel comfortable and how can we make you feel reassured to know everything's going to be okay and let's put interventions in place. But
Yeah.
I do think that we have to keep that in mind because our modeling is so much stronger than we think.
No,
And I
I
just
think it's
wanted
a
to
great,
emphasize that.
that is a great point. So thank you. I mean, many of our, look, when you're anxious, you get like a flat affect. You can almost look angry, and that's not your fault. It happens to all of us. I mean, we see this with families that come to us sometimes. They're so nervous, they're so anxious. Like a family flew across the country, has been in treatment for 4 years. This is our last hope. The parent's nervous and anxious. And so sometimes they have that like flat affect at first, and we realize that's their anxiety. But if your child is picking up on that and seeing you anxious or, looking upset with them or frustrated, then yes, that's going to project onto them and make them actually hold on deeper and more because they're fearful. Like, I'm making my mommy anxious, or what's going on, or she seems angry at me. So, of course, we're not saying this is happening necessarily in this particular case. But the point of these questions is because we're not working specifically necessarily with you, is to give you different angles to think about so that whomever you're working with can help explore this. What are the accommodations, interventions in the school? What is set up to help the child with separation, the buddy process, the teacher meeting you outside, creating charts to wean you out? And what is the separation and challenges in the home environment to see how pervasive this separation is? Are there other anxieties, generalized anxiety? Are there other whys? Is sensory an issue? Like, what is going on? Is that, what else is happening? You mentioned the child is speaking to other friends, but is it socially appropriate language? Is there social reciprocity? Is there, rigidity? Like, are there other whys happening that we need to address? So I think it's very important that we see this again from a whole person standpoint, since I preach that. That's what SM treatment is, treating the whole person and not a symptom. I swear by that to my last day on this earth, is that if we treat to speak without understanding, we're going to miss the boat on most individuals. So this understanding of this child is important. In fact, even if you told me your child wasn't verbal, all of these things would still need to be in place. So yes, she's verbal with some. I don't even know what her communication is or comfort with her teacher. So the point is, thank you for that baseline, but the speaking I can set aside right now because all of these other things need to be in place.
Exactly. We'll get back to the episode in a second. You're exhausted from advocating, explaining, and hoping someone finally understands. Well, we do. This summer, consider Communicamp for you and your family. Communicamp is the Smart Center's intensive all-day treatment program designed to help children and teens ages 3 and up build social communication confidence. Over the course of one full weekend, your child or teen receives 15 plus hours of expert-led skill building, while parents receive 15 plus hours of training and support. Our clinicians use Dr. E's evidence-based treatment, SCAT, that's helped thousands of individuals find their voice. Here's what matters. Unlike other programs, your child or teen doesn't need to talk to come to camp. We meet them exactly where they are. We have 3 Communicamp weekends happening this summer: June 26th to 29th, July 16th to 19th, and August 7th to 10th. Visit the link in this episode's show notes to learn more. Stop waiting for your child or teen to grow out of it. Make it happen this summer. All right, let's get back to this episode.
So let's go on to our next question. My child, his name is James, is in stage 3. So this child is verbal in school with teachers and peers, but he's basically whispering and refuses to use his full voice. How do we help him progress out of whispering? You know what I'm going to say, right? What is the first thing that we're going to say?
We don't typically focus on whispering because it emphasizes more anxiety.
We don't focus on whispering in a way that's so direct all the time, but we also don't want to think of this as refusing. It sounds like James has found his voice, kind of like edged his way in, but hasn't gotten past the whisper stage. Maybe he was a speech phobic before, because many speech phobics enter into speech through whispering. It's a natural step in the process for most kids with SM, because they may not have verbal communication and confidence and experience with more than 1 or 2 kids if they eventually get there. Before they're like, maybe that's their baseline and maybe the teacher. So they edge into speech. They're not going to speak in a regular voice across the classroom for most individuals until they've made the kind of comfort and progression of communication from one-on-one to small groups to large groups. So we have to be aware that quiet speech is normal and typical. But if we rush the child too much, you need to talk, you need to talk, you need to talk, and you see it as a refusal, then that child is picking up on that, and we have created an avoidance. So now we have a selective whisperer or a chronic whisperer. And so now we need to back up. Sounds like James is older, so we can talk to him about it. And we've talked about the verbal knob. We've also talked about increasing the distance and working on the volume. And many individuals we have seen with SM hear their voice louder in their head. And there is some research with that. And so for them, in a louder, larger, lots of people environment, whispering is a way for them to regulate themselves, because it's so loud that the whispering is a way for them to kind of regulate. And so what happens is it starts out that way. But when we push, speak in a regular voice, we create a chronic, perpetual whisper.
Yeah.
Any thoughts? Because I feel like I just answered that. Sorry.
No, I was going to say a lot of what you said, but I do think one thing I wanted to add is, one, I think it also depends on how long of a time is this, right? So I know we have talked about, like, obviously, we don't usually focus on whispering, and we do find that naturally our voice levels do increase as comfort increases. However, like Dr. E said, if we notice that we're becoming more of this quote unquote selective whisperer, there are definitely techniques to utilize to get us feeling more comfortable, especially when we're at a cognitive level as a child where we can work through that with them step by step. The other thing I was going to add too is,
well, I would also say that because James is, and we can kind of like just erase that part of it that
Mhm.
you said ads. They can do that. What I was going to say is that James being a younger, an older child, so to speak, a younger teen here, his involvement in this is important. So, without giving him the roadmap to increase his volume and to really understand the nature of this whispering and when it's occurring, where it's occurring, with whom it's occurring, it's really hard. And
Mhm.
so we need to help him have his own roadmap in his
Yeah.
treatment. And we've created different charts where it's different volume levels with different individuals,
Mhm.
turn up the verbal knob, but also his awareness and practicing that level away from the school environment so he knows how to increase his volume. So
Right.
we will work on that in session.
Right.
And I've worked with lots of kids with these pervasive whisperers, chronic whisperers
Mhm.
that have now had a selective whisperer
Yeah.
diagnosis, even though it's
Yeah.
not an official
Yeah.
diagnosis. So
Yeah.
his active involvement in this is important.
Yeah, and I think the last thing I was gonna say is we also wanna keep in mind that if this is a newer development and he's now progressed into stage 3, which is great, really being mindful of what is the language that we're using with him, and kind of giving maybe some psychoeducation to our teachers about that, not talking about the whispering piece, but kind of just, like, very nonchalant accepting where he's at. I have many individuals that I work with, and that's where visuals and choices is really helpful because let's say we're going through favorite questions and I'm asking like, what's your favorite subject in school? What's your favorite musical artist? Right. And we're kind of going through different things. I have some individuals that I work with where I'm asking, like, for example, like, who's your favorite musical artist? Right. Like, are you, and I think we said this as a teen, like, are you into like Sabrina Carpenter or Taylor Swift? Right. And let's say the teen wrote like Taylor Swift, right? I have some teams that literally, with the use of the visual and with the use of the choice, they might come in, but it might be very quiet to the point where it's like, right? And for those that are listening, you might not even hear that, but I'm showing it from a visual standpoint that there's barely words that are coming out, but I kind of accept that, right? And
Yep.
I say, "Oh, wow, I also love Taylor Swift," right? And I kind of
Right.
move forward. And this has happened so many times with different individuals that I've worked with where over time, I see it all the time. I might just come into the next session and the child just talks in a regular volume, right? It's very natural. Now, again, there's a spectrum of how every individual is different, but I feel like sometimes when we accept where they're at and we're showing them, that's okay. We're dipping our feet and we're getting there. It really
Yep.
makes them feel safe and comfortable, which then kind of they look around and they're like, "Oh wait, no one's focusing on this." And that can then also allow them to naturally increase their volume level.
So as kids are entering into speech, and I said that whispering's a natural aspect to this, and it's very expected, accepting it, ACC. I always say, and I always have to, I always spell it out too, ACC, accept, not EXC. So we accept it because it helps them realize the person heard and it's no big deal. And so, as you said, as they're moving along, we're accepting it, we're repeating without eye contact, we're helping them understand, and we're taking that pressure off them to speak in a regular voice, speak in a regular voice,
Exactly.
speak in a regular, like, stop already. You got to pull back. This child is obviously chronically whispering for a reason. And usually that reason is too much attention to it. So pull back. In therapy, he should be working on this in a very upbeat, positive way to help him, not refusing or choosing, because that concerned me when I saw the word refuses. It makes me feel like it's willful and choosing. And that message to that child is not a good feeling. So
Mhm.
I'm going to assume that the person that wrote this in didn't really mean refusing, because we know that SM is not a choice.
Right.
They can seem avoidant. They can sometimes seem like they don't care, but it's usually because of their own lack of understanding and know how to make that progress. So I
Right.
think that is, really important to talk about. Also, when one last thing is that I find that when kids are reading, similar to what you said, their voice gets louder naturally with the reading of words. So if they're in a friendship group or they're reading directions to something for an older child, I find that they naturally start to progress. And we have videos of kids that we will show, they'll start out whispering like this, but as they get a little bit louder, their voice gets louder. And it's really amazing to watch. And again, we don't also say, oh my God, you spoke in a regular voice. Oh my God,
Right.
you can do it. You can do it. Stop doing that. Accept it and be okay with it. But
Right.
again, what is James' involvement in treatment and his know-how and sense of control? So we're at our last question of the day. My child is a older in child. They are a 13-year-old, early young teen, and has been mute in school since pre-K, refuses accommodations, any sort of cards or signs, and suppresses all emotion and reactions. He is fully verbal at home, but mute in church and lessons. We've tried interventions without progress. Help me. What strategies can we implement? Remember, it's a young teen. Thoughts, Dr. Jenna? No motivation. Absolutely none. This
Mhm.
mom is saying. Doesn't
Yeah.
have any desire for change.
So I think this is where, again, we always talk about how SCAT, right, the social communication anxiety treatment that we utilize, really does encapsulate many other different modalities. And there's one modality in particular that I like to work on with my teens, which is called motivational interviewing. And that's really where I kind of assess, like, okay, well, where are we at, right? And if someone's like, I do not want this at all, we have to take a few steps back sometimes, then take a few steps forward. And so, of course, as a parent, we have many teen families that do this where they're like, we want our child to get the help. We want our child to get the help. And we want to be there to help you. And maybe it starts off with giving some parent guidance, right? And maybe that's our first step. But it also comes with, well, let's take a step back. Like where is this lack of motivation coming from? And that's a really loaded question. That could be a whole other podcast, but you know, where is it coming from? Is it coming from the fact that we are feeling this increased expectation, and maybe as we're becoming a teen, it's becoming more learned and conditioned, and so the more and more that we haven't been doing this, the more and more that we're paying attention to it, the more and more that we don't want to deal with it. And there's that avoidance piece. How do people react when I maybe start to work on things, right? So there's that increased expectation too. Is it that we lack maybe some of that insight, and or do we maybe have other underlying whys that are maybe contributing, which is making it harder for us to understand the depth of the motivation, or why we want to be working through this? We have many families that we work with where the child or teen doesn't understand why they're navigating this. And there could be other underlying factors. For example, we have some individuals that we work with where they might have some other social communication deficits, right? Whether you're on the spectrum or maybe you have social communication pragmatic disorder, and you're not really understanding all the times, well, these pieces, right? There's maybe that lack of that social know-how and how to navigate that. And we always say, like, we might not be the driver in the car. So knowing kind of how to navigate that is really challenging. And so we just don't go there.
No, I
So
think
I
you're
think,
bringing up a really good point. By no means are we saying that this particular individual has autism spectrum disorder. But the thing that comes to mind here is that we do work with more than people realize of individuals that are on the autism spectrum or have the social pragmatic challenges where that innate puzzle of social puzzle's hard. So I'm not motivated to do this. Like, I don't care. It's not important to me. And maybe it is not. One of the things we see with ASD is that it isn't important. The social navigation isn't important to them. So this isn't necessarily refusing. It's one, it's not important to me. That lack of internal motivation is very, very common in individuals on the autism spectrum. So I would want to know, are there other things going on? So I didn't mean to interrupt, but I just think it's important that what is going on else with this child. Also, what type of treatment did they have, right? Was it focused on speech only when the child had underlying whys and they became more avoidant? What is the relationship, parent-child relationship? Is it, you need to, you got to, you should language all the time versus understanding and talking with them in a way? And what treatment have you been in? What treatment has this
Mhm.
individual been in? We see a lot of not motivated individuals that are not on the spectrum, but it's because they've been so misunderstood and nobody or very few were meeting them where they were at. They were expecting too much before they had the ability to do it. So the avoidance comes in, the lack of motivation comes in.
Right.
So I would want to have a meeting of the minds. And we talk a lot about this in our individual care, but we talk a lot about this at Communicamp, where
Yeah.
we tell parents, like, what you are learning over the course of these 3 days, share with your kids in an upbeat, positive way. Even admit to them if there's things you were doing that were not necessarily correct. Like, wow, I learned a lot about the bridge today. And I realized that when we go to gymnastics and there's so much going on, I realized that even though you're able to talk to your friend and be comfortable at home, that there's so much going on. It's like really loud. And maybe we need to bridge down a little, or maybe we need to pick a class where it's maybe during off hours. And like we talk to them and meet them where they're at. And it's
Mhm.
amazing how when we do that, it opens these kids up. It
Yeah.
really opens them up. It's almost like, wow, there's like an
Mhm.
entrance to a door to meet in the middle. And
Yeah.
we've had to do so much work with parents and children
Yeah.
to help them connect instead of being so separate.
Yeah.
Because the last thing we want to do is not, well, last thing we want to do is make this child feel that they're purposeful.
Right.
It's look, listen, and learn. What is your child telling you by his lack of motivation?
Right.
Right?
Right. Yeah, and I think one other thing I wanna add is, so we talked a lot about teenagers in regards to building independence, so I definitely recommend looking at listening to that podcast because some of these things that we're talking about is emphasized in there. Because I think teenagers itself, there's so much complexity going on and this push and pull with treatment and wanting to kind of push through. But one of the things I talked about in that podcast was this motivation scale that a lot of times we use. And we talk about from a scale between 0 to 10, 10 being, the most motivated. Like I really, really, really recognize this is really tough. Like this is really hard, but I recognize I really want to work through this. And 0 being like, get me out of the room, right? Where do we feel on this scale? And so many times, even I think you say this a lot at Communicamp, like even the individuals that say they're like a 3, right? Or like a 2, like
Or
anything
even a
honestly
one,
over
or even a one out of
even,
10
like, anything
motivation.
over, like, a 0, it's like, they're motivated. There's just so much uncertainty around, like, well, what is it gonna look like, right?
Yeah.
Like, how am I gonna navigate this? What is the first step, right? It's like you're literally looking up at this mountain and it's like, am I about to take this leap, right? And so, I think that sometimes we just have to start there, and I say that's okay, and sometimes I even start with writing down, like, in a perfect world, like, if we could throw away like, if this was, like let's say this was, like, a bag of or, like, a box of, like, all of the scary and the anxieties, and we could just throw it out, like, would you wanna be here, right, and work through this? And let's talk about that, and sometimes I even start with writing down, like, a list of goals that they maybe wanna work on, and sometimes I have teens that maybe have a hard time coming up with their goals, and again, there's various reasons why. Some kids also might have some underlying expressive challenges, but also, again, maybe there's that increased expectation of like, well, if I tell you this goal, like, what are you going to expect of me?
Yeah.
And so a lot of times I actually will provide them like, by the way, you don't have to say yes to any of these. These are just common goals that a lot of teens and young adults feel that are very similar to you. And then I notice like after I kind of maybe present a few, noticing slowly they're kind of starting to circle one or two, right? And they're really starting to identify with those pieces. So I think really that helps me the most is like meeting them where they're at and not
Yeah.
saying this is what you're going to do and
You
kind of be
need
more
to, you should
authoritarian.
language. For every parent
Yeah.
listening to this, let's eliminate you need to and should language. When someone says to me, you need to do this, Dr. E, you should do that. That puts pressure on me. It makes me feel like, whoa, what did I do wrong?
Mhm.
And so when we're dealing with teens, to sum this up, this question, and I'm going by again my years of clinical experience, it's a few things happening. One, parents and teens are really on different pages, that they have become disconnected. So that lack of motivation may be a reaction to, I'm not feeling support. And it doesn't mean you don't love your child, but you guys are at like batting each other. Like the child's in their room all the time. They're not talking to you about other things. They're not going out with you as much. You seem there's anger going from both sides. Like, what is that about? Right? Is
Yeah.
that happening? Is there something we're missing? Is there a social communication challenge? Is there an ASD? Is there a pragmatic challenge? Is there some other problems that are causing this child to not have that motivation? They just don't care. And I have picked up on ASD when we have these kids that are like, I don't want to do this. Like, it's not
Mhm.
important to me. It's just not.
Yeah.
And it's because it doesn't mean much to them. So, is that going on? Has there been treatment where it's been unrealistic for that child? You need to, you should, and you need to be really brave and courageous to do it. But the child doesn't have their roadmap. We're not meeting them where they're at. We're meeting them way in front. We're not even meeting them. We're all the way in the front and the child's in the back. That's a sense of shame. I can't do it. I'm not doing it. Everyone's mad at me. Everyone's upset with me. They're expecting me to. I'm a loser. And that's how some of these kids feel. So when we meet them where they're at and we open up and we talk and we help that child realize all that they can do, not what they can't do, it's amazing how they start to open up. But if they're not, despite all of these other supports we're putting in place, despite the relationship building, and we really dive deep into who that child is, we find out, whoa, there are some other challenges. There is some other testing we may want to do to kind of see what else we are missing from a social communication pragmatic challenge. And so I feel like there's a lot with this question, right? And this is not an uncommon presentation at all. So we need to dive deep. We need to dive deep. We can't just like look at the surface. It's all diving deep. Every family is different. I've never met two kids that are the same. I've never met two teens that are the same. I've never met two adults that are the same that we treat. Everyone is different. There's so many dynamics at play in every aspect. So that's why it's hard to say, do this, do this, do this. Like, I need strategies. Okay, well, what am I giving you strategies for?
Right.
Okay, not speaking. Well, look at all that goes into not speaking. Not just do this and be brave to talk. It doesn't work. It only works when they're ready to do it. And if they're not ready to do it, we're creating avoidance, more anxiety, more disconnect, frustration on everyone's part. I just feel like I just like passionately went at that.
Yeah, I think you did too. But I think it's a very passionate question. And I do think I encourage everyone to listen to our independence podcast, because I think we really talk about a lot of these themes in there as well.
And there's two. There's the elementary, building independence with your elementary age child, and building independence for your teen, because we have to help them become a more confident being. All of these kids where they have good self-esteem. I was consulting with a family just yesterday, and it was like a 6-year-old child. And when we were talking about aspects to his treatment, we talked about self-esteem. And the mother said to me, wow, this is really interesting, because I was so concerned about getting my child to talk. But in reality, his confidence is really pretty low. And we talked about ways like he happens to love to play chess. So starting a chess club, starting a chess get together with another child, building that confidence, being the big shot with chess. Like, there's so many aspects to treatment. There's so many things that go into treating the whole person and not just a symptom.
Yeah.
And it's really empowering, and you can really see progress, and it doesn't have to take long. It really doesn't. It really is about understanding, assess to understand, and then developing that step-by-step treatment plan for home, real world, and school that really meets that child where they're at and respects who they are as an individual person. I think that's a good place to end.
Yeah. Yeah. Well, thank
Any
you for
last
having
minute
me.
comments? Oh, I love having you. Are you kidding?
Yeah. No,
It's
I don't.
really a breath of fresh air.
Yeah, no, I don't have any more to add, but it was definitely fun to do this segment with you. And I hope that the families that brought in some of these questions and families that are listening that maybe relate to these questions really find it really useful. So thank you. And until next time.
I'll see you soon, Dr. Jenna.
See you soon.
Thank you for listening to Unspoken Words, a Selective Mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask-DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.